Namatay ang 3 menor de edad na bata matapos pagtatagain ng sarili nilang ina sa Basud, Camarines Norte. Edad na 5 taon, 1 taon at 4 na buwang gulang ang mga nasawi.
What happened with those mothers? What could have been done to prevent those from happening? You've probably heard of postpartum depression. It's gotten a lot of press, and trust me, that's a good thing, because postpartum depression is very real and worthy of your attention. The mental and emotional well-being of expectant and new mothers, troubling rates of maternal depression and anxiety, as well as their effects on mothers, families, and communities are a growing national concern. Maternal mental health encompasses mental health disorders during and after pregnancy, including mood, depression, and anxiety disorders. 15 to 20% of women will experience depression during and after pregnancy, and up to 15% of women will develop anxiety during pregnancy or after childbirth. Research shows that recognition and treatment rates for depression specifically are lower in pregnant and postpartum women. Here in the Philippines, it is estimated more than 126,000 cases of PPD in 2004. But this number has been heavily measured through statistical extrapolation only rather than an actual count. Monitoring of these cases is limited, potentially due to lack of a universal screening tool. This complete lack of statistics, information, and education regarding this disorder is alarming. Suppose this continued to be untreated and undiagnosed. According to Department of Health, maternal postpartum depression, it is a typical encounter of women in the Philippines. It is burdensome that strikes numerous women during and after pregnancy, anytime within the first year of infant's birth. Postpartum depression isn't a character flaw or a weakness. Sometimes, it's simply a complication of giving birth. It is a serious mental illness that involves brain and affects your behavior and physical health. Hormonal changes may trigger symptoms of postpartum depression. When you are pregnant, levels of the female hormones estrogen and progesterone are the highest they'll ever be. These feelings are common among new mothers, and levels of thyroid hormones may also drop after giving birth. Low levels of thyroid hormones may cause symptoms of depression. Though postpartum depression is a serious health condition, everyone should know that it can be avoided and it can be treated. In the first 24 hours after childbirth, hormone levels quickly drop back to normal pre-pregnancy levels. Researchers think this sudden change in hormone levels may lead to depression. This is similar to hormone changes before a woman's period, but involves much more extreme swings in hormone levels. Untreated maternal depression and anxiety can have negative short-term consequences ranging from inability to self-care, to disruption of infant-child bonding, loss of employment, substance abuse, divorce, self-destructive behavior, or even suicide. Other known sociological impacts includes adverse effects on the child's physical and psychological development, child abuse, neglect or death of infant, and family disruption. Postpartum mood changes are common and can be broken down into three subgroups: baby blues, postpartum anxiety disorders, and postpartum psychosis. According to AmericanPregnancy.org, baby blues are mood swings after the birth of a baby. While the baby blues are the least severe form of postpartum depression, it is important not to ignore the changes that are happening in your body. Many women feel confused about struggling with sadness after the joyous event of adding a new baby to the family and often don't talk about it. But talking about these emotions, changes, and challenges is one of the best ways to cope with the baby blues. The symptoms of the baby blues normally occur for a few minutes up to a few hours each day. These symptoms should lessen and disappear within 14 days after delivery. But some new moms experience a more severe form of depression, known as postpartum depression. If you feel being sad, flat, empty, or hopeless, and it does not go away and can interfere with your day-to-day life, or if you might feel unconnected to your baby as if you are not the baby's mother, or you might not love or care for the baby, you might have postpartum depression. It's natural to worry about the birth of your little one. You wonder, are they eating well, sleeping enough, hitting all their precious milestones? And what about the germs? Will I ever sleep again? And how did so much laundry pile up? Perfectly normal, not mention a sign of your already deep love for your newest addition.
But sometimes, it's something more. If your anxiety seems out of control, has you on edge most of the time, or keeps you up at night, you may have more than the new parent jitters, and that's postpartum anxiety.
Keep in mind that most, if not all, new parents experience some worry. But the symptoms of postpartum anxiety disorder include constant or near constant worry that can't be eased, feelings of dread about things you fear will happen, sleep disruption. Yes, this is a hard one to pick out, since a newborn means your sleep will be disrupted even without having anxiety. But think of this as waking up or having trouble sleeping at times when your baby's sleeping peacefully. Raising thoughts, and if all that wasn't enough, you can also have physical symptoms related to postpartum anxiety, like fatigue, heart palpitations, hyperventilation, sweating, nausea and vomiting, shakiness, and trembling. There are a couple of even more specific types of postpartum anxiety: postpartum panic disorder and postpartum obsessive-compulsive disorder. With postpartum obsessive-compulsive disorder, you may have obsessive, recurring thoughts about harm or even death befalling your baby. And with postpartum disorder, you can have sudden panic attacks related to similar thoughts. So when you have a postpartum panic attack, you will feel symptoms such as shortness of breath or sensation that you're choking or unable to breathe, intense fear of death for you and your baby, chest pain, dizziness, and racing heart. Postpartum psychosis is rarer than postpartum depression and involves symptoms that include delusions or hallucinations and can put both the mother and her child in danger. The condition affects 1 to 2 out of 1,000 women and tends to present within the first 2 to 4 weeks after delivery. The onset of postpartum psychosis is often sudden. In addition to psychotic symptoms, patients can also develop symptoms of paranoia, mood swings, and confusion. Some research suggests the women are at risk of postpartum psychosis if they have a family history of bipolar disorder or schizoaffective disorder. In rare cases, postpartum psychosis can lead to suicide attempts, even rarer attempts of infanticide. Like postpartum depression, postpartum psychosis is also treatable. With the right treatment, you can recover from postpartum anxiety and bond with your sweet little one. How can you take care of yourself to decrease the symptoms of baby blues? Talk with someone that you trust about how you are feeling. Maintain a well-balanced diet. Having a new baby may cause you not to eat correctly, and too many simple carbohydrates can make mood swings more pronounced. Keep a journal of all your thoughts and feelings. Get outside to enjoy fresh air and life outside the confines of diapers, feedings, and spit up. Sometimes, just a different view for a few minutes can make a huge difference. Ask for help. Help with meals, other children, getting into a routine, or any help that allows you to focus on the joy of having a new baby and not just the pressure of juggling it all. Don't expect perfection in the first few weeks. Give yourself time to heal from birth, to adjust to your new job, and for feeding and sleeping routines to settle in. And the most important step is to get diagnosed. Don't stay silent about your symptoms. Be sure to go to your postpartum checkup with your doctor. This is usually scheduled within the first 6 weeks after delivery. Some women don't tell anyone about their symptoms. New mothers may feel ashamed, embarrassed, or feeling guilty about being depressed, as they are supposed to be happy during this moment. They may also worry they will be seen as bad mothers. Any woman can become depressed during pregnancy and even after having a baby. It doesn't mean that you're a bad mother. You and your baby don't have to suffer. There is help. Your doctor can help you figure it out. Please know that you are not alone.
Postpartum depression and anxiety are scary, whether you get hospitalized or not.
It seems like it's the end of your life and you knew it. It can creep up on you and wham you over the head with no warning. Postpartum depression is infinitely unfair.
It doesn't make any logical sense.
It feels like you'll never get better. It feels like you're not a good mom.
I understand. So many of us do.
We know how postpartum depression feels.
We know this feels like it's way too much to overcome, but you will. Even if you can't see it, and I know most of you can't right now, you will.
You are enough.
You are a good mom.
Whatever path you take to get better, we are proud of you for taking these steps.
So proud of you for recognizing you deserve better.
But this is not the way it's supposed to be, and you don't have to live like this.
If it took a few years for you to recognize it, or several months, reaching to more than a year, that's okay. We're still proud of you. We hold your heart in our hands.